Yes, ma'am. Yes, ma'am. Thank you. Good afternoon, everyone. Thank you, chairpersons, for continuing. Introduce.
It's my privilege and I'm happy to present to you Dr. Jamuna Devi Gadivegi,
कोई
Senior,
बात नहीं, कोई बात नहीं.
Senior Consultant, Yashoda Hospital. She has a current affiliation to Foxy member, life member of IMS, ISOPAB and PCOS Society, BCS member and FPAI, IML and IWC. She is holding the important positions and achievements currently. Secretary TCOG, CP State Medical Legal Committee President elect HMS and TR. GUCOG 2026, AICOG 2011, Joint Secretary 2023, Treasurer. She has authored Obesity, a malediction in Midlife Reader Digest IMS 2025 to co-author Cardiovascular Health in Menopause EFBR 2025. She has co-authored Patient Safety 2011 article in POIS Fallopian Tube Cancers 2020. What is osteoporosis 2021? So here I present Dr. Jamuna. Thank you so much.
Thank you. Thank you for. Actually, I should thank the chairpersons to stay back for my talk. Thank you so much. And thank you for that introduction. And I think we have quite a few audience. So they have given me this whether JCM laser is useful tool or it is overhyped. So, and I'm sure this innovation always should be guided not by excitement alone because it's a new lasers and all those things, but evidence also should be there, and we have to look in for safety and patient outcome most importantly. So I'm going to take you through what is the worldwide data, Indian data, and what is the impact of GCM in women's affecting the quality of life, and not only that, after the laser therapy what was her quality of life, and then management because it is a non-invasive one, and what are the organization statements and recommendations for this therapy, and there are some regulatory concerns also, and then we all can decide whether it is useful or overhyped. So now global prevalence around it is 24 to 45% of the women experience incontinence. That's a big number. And one in two women suffer from SUI, and women suffer from SUI more than the chronic diseases. And childbirth impact, BMI, obesity, and we all know obesity is becoming so rampant now. And we see a lot of adolescents and reproductive age group having this obesity problem. And these can modify the SUI. Now, as per Procter and Gamble, what they said is they sell more adult diapers than infant diapers world over. They make a lot of money out of that. So this shows that SUI is so rampant, and age factor risk rises significantly after age 40, and this prevalence is increased to 50% in menopausal and postmenopausal women. And in India's study, which is in 2025, they have done an observational study in 219 women between 18 and 60 in Pune, and they found that 32% reported stress urinary incontinence. This is a big number with significant impact on physical activity and quality of life. So this is the age-wise distribution. You can see this 18 to 25, 50%, and 41 to 50, 55 to 56%, and of course 61 to 70 years of age, 43 to 60%. So from adolescent to the menopausal and postmenopausal age group, anybody can get affected with this SUI. Now, what is the evidence from we get from the studies? There was a pilot study in Taiwan in 2022 and 23, and they have done on 41 women with GSM and SUI, and they gave weekly sessions for 8 weeks. So they saw that significant improvement in vaginal health index, urinary symptoms, and sexual function. And in postmenopausal, they have done fractional CO2 and area lasers, and they saw that long lasting relief improved and intimacy and minimal downtime. So, this gives us an encouragement that it is a useful tool. Then, of course, the early evidence is there, but there is enthusiasm grew among all of us. Now, this is a very good subspecialty. We should learn, we should practice. So, this is there. So, and we have seen that it is short term improvements, VHI, vaginal pH, FS, FI scores, GSM symptoms, minimal downtime time, and few immediate adverse effects which are negligible. All these put together, now we have all become enthusiastic. So let us start practicing. Especially, I tell in every we do skill training and tell the women obstetricians, once you are retired, you don't like to do obstetrics, all of us. So this is another subspecialty which we can start looking at it and learn and do it. So now I'll just talk about this recurrent vaginal infections, not about the infections, but an estimated 340 million women. We see new cases are reported worldwide each year, and over 50% of these happen in South and Southeast Asia. So naturally, these cases need help and we have to treat them. And it causes discomfort, impact of quality of life, and economic productivity because if they are in the working professionals. Then vaginal dryness prevalence is so high, and most of the time it is underreported. And only 25% of them seek medical help, and we know that 47 years age is the menopausal one. And here, even in menopausal and postmenopausal, not many women come with this complaint. Only when you are asking, they may tell. So these are the unspoken problems which are experienced by the women. And I think these are the women whom we have to take the history and we can help them in from these problems. So, what is the promise? We need studies reporting saying that it reduces vaginal dryness, improves dyspareunia, better sexual function, enhanced quality of life, and there is very high patient satisfaction. So, potential advantages we all know, non hormonal option for women who refuse hormones, and of course, the surgeries also. And some of them are contraindicated for other treatments. Then office based procedure, and it attractive to the patient seeking an alternative. Because if I tell that, oh, you take hormones or you go for surgery, but this looks like an attractive alternative. Some studies report improvement in dryness, dyspareunia, vaginal health score. Then major limitations, what is that? Because still the evidence remains very low. Benefits are not confirmed because there is no robust controlled trials. And NAM states that there are insufficient placebo controlled trials to recommend that these energy based therapies, including lasers, are beneficial to the woman. Then RCOG advises it should be adopted into widespread practices and should be used only in research settings. So there are long-term durability is not estimated, and there are no ideal protocols, and cost effectiveness remains very unclear because it is not same everywhere. Then what NAM says is there is insufficient placebo controlled trials, and it emphasizes the standard GCM therapies like we do have this lubricants, moisturizers, vaginal estrogen, vaginal DHEA, systemic hormone therapy, and all other those alternatives are there. Choice of therapy should depend upon the symptom severity, individual safety consideration, and patient preferences. So RCG notes that in most published laser studies are very small, very short term, and they are just observational. So it concludes that laser may be beneficial, but should not be adopted into widespread practice. So they say that it should be only a research study. And ACOG states that laser and other energy-based treatments are not approved for menopausal symptoms or urinary incontinence or sexual problems. But it highlights that FDA warnings about serious harms such as vaginal burns, scarring, dyspareunia, and patients' persistent pain. But it advises that first resource for a vaginal symptom should always be the OBGYN and established care pathways. And after that, only we should go for these lasers. So, FDA approved alternatives for GCM, low dose, all these things we all know about it. But I can uh, tell some of the cases which have gone through all these procedures, but still they had no relief. So this is the one case where these are live cases. I'm not taken it. Some of it are from my clinic, and some from my friend's clinic who practice this laser treatment. And this is 65-year-old postmenopausal women who came to me, severe burning sensation, itching in the vagina and introitus for months and months together. And she has taken lot of medications and local creams, and lot of laboratory tests was done. But she never got any relief with the above medications. And despite that, she was visiting so many OBGYNs. So anyway, we have counseled her and we told her, explained to her the pros and cons of the laser therapy. She agreed upon and she underwent 2 sessions of laser. And last one, we did PRP. And believe it, I was so happy when she told that my 70% of the problem is solved. And we were very happy that at least we could give a good quality of life. And this is another lady, aged 80 years. She came to the clinic with intractable pain in the intimate area. And she also went to multiple doctors, extensive investigations were done. But later, counseling was done, laser therapy done, just for 2 sessions only. And she said 70% of her problem was solved. Unfortunately, what happens when they have good relief? 50 to 60 hours, they won't come back to us. And they say that they are very happy with whatever treatment they have taken. That is the reason why we don't have long term effects. Then this is another lady visited the clinic with SUI. There was no relief with all available treatments. After investigating and counseling, laser therapy was done. She shared this message, and I wanted to read this for you all. I went in for a laser treatment on my bladder issues, and honestly, after 2 sessions, I was already noticing real difference. Feel more comfortable and confident now. I'm really happy with the treatment. These are the own words what she has shared with us. And these are some of the pictures. See, you can see before and after. Of course, these pictures are not done so clearly. And we can see that vaginal laxity is reduced. And even SUI symptoms were reduced. So now I think you all would agree with me. It is a useful tool. Yes? Non-hormonal option, high patient acceptability. Some women obtain meaningful relief, minimally invasive, expanding evidence base. That we need to do it. And most of us are practicing this subspecialty, but we not collecting the data, nor we have any registry to compile that so much of data is there. That is the problem. But one of my friend, she is practicing in Rajamandri. She has treated 10,000 women with SUI, vaginal laxity, vaginal dryness, all these, because she runs an old age clinic for women. So when they come with all these problems, she has treated them with the vagina lasers, and she has collected that how many of them got relief. And this is a big data. I'm just pushing her and encouraging her to collect the data and at least publish. At least it is one of the best publishing, I think, data will be there in India as well as international standard platforms. So we all have to look beyond estrogen, just not estrogen. Fear of hormones will be there in a lot of women, even today. Then we know that breast cancer survivors or endometrial cancer survivors, poor compliance with long-term vaginal estrogen, preference for non-hormonal options. And I'm telling you, it is a growing demand, but only thing is patient selection is very important, counseling is very important, and no giving your opinion that it will be 100% relief. We should never say that. The relief, the person, I mean, women has to tell us after 2 sessions or 3 sessions, whatever. The other side limitations, as I told you, no, not many studies. The sample is very small. Then lack sham controls. Industry sponsorship is there. Now we think that industry driven practice it is. And then short follow up and heterogeneous protocols. That is one problem. We don't have a uniform protocols for at least all of us in India. So, yes, sometimes it is overhyped because marketing often exceeds the evidence because it's an expensive treatment, lack of long term outcome, and it is still not recommended as first line therapy. So, society recommendations, North American Menopause Society, they say that we need more evidences and no first line therapy. And International Urogynecological Association also considers investigational International Society for the Study of Women's Sexual Health, shared decision making essential. So, these are the recommendations from the other societies. And the regulatory concerns, we all know it is 2018 FDA safety communication warned against marketing vaginal lasers for GSM, vaginal rejuvenation, and sexual enhancement. And concerns are because it is insufficient evidence, potential burns, scarring, pain, but the cases are very less. I'm telling you, it is not even 1%, it's less than 1%. So these are the women who are all, having sad faces and all that. How about we converting them to a smiling faces? Thank you so much. Very nice, Dr. Jamuna.
Thank you, Dr. Jamina, for elaborating such untouched topic. There are plenty of gynecologists. They are practicing laser practice in every town. You may see one, two, three gynecologists with the advertisements, or may not be with the advertisement, and performing these laser surgeries with 100% successful rate. What you told, that patient has to tell how much improved she has got.
Yes.
Thank you so much.
Thank you so much. Thank you, the organizers and the chairpersons. Thank you.
We need to present a study.
Yes, but I will get it done.
Indian law.
Yes, yes, I'll get it done. And I'm trying to help her here. I want her to be the but only the skills have to be developed properly. That is more important.